Well, the face of the uninsured has no stereotype, as you're about to see in our next story. Robert Wallens worked in corporate America most of his life, but when he retired, he found himself too young for Medicare and without enough savings to afford very expensive health care. Robert Wallens has spent most of his life in a much more fast-paced way, working in New York City in the telecom industry. But after his wife passed away, he needed a change.
I was prepared, actually, to live and work in New York City and teach in that school because I felt very positive that I was actually making an impact, but I felt that for my own sake, that I needed to come home here to Florida. I was a Florida resident the entire time.
Soon after he moved here, he found himself feeling ill, short of breath. And after a $2,000 visit to a local emergency room, he got the diagnosis.
I was no longer covered by a policy, and I noticed that my breathing was getting progressively worse. It turns out that I'm allergic to anything that's green here in Florida. It's not that I have a problem, it's just that the problem is there are so many things, so many lush things growing, and my poor body is only used to Midtown Manhattan grime and smog.
Wallens was in trouble with his health and his health care.
I said to the cashier, I have no money. And that's exactly what I said. I figured, let me start from that perspective. And she said, what's your income? And I said, what income? And she looked at me, and it turned out that there was this thing called Vita Health.
Vita Health are premiums that need to be paid on a monthly basis, starting as low as $25 a month. And then we pay the 2/3 shared cost of the premium for the member.
Customer service, Esther speaking. How may I help you?
The low-cost insurance program is funded through the Palm Beach County Healthcare District and covers primary doctors, outpatient, and hospital visits. That fact has helped Robert breathe a bit easier.
I was actually afraid to go for regular checkups and so forth. It was discovered that I had some issues that are more age-related than anything else, and I was given some medication to deal with it.
Ronnie is the Director of Eligibility for all coordinated care plans. That includes the one helping Robert. She says the uninsured crisis is not just affecting the poorest communities in Palm Beach County.
It's hitting a different population now. Many of our clients never had to apply for any programs before in their life, and they're unemployed, they're losing their home, they're going through foreclosure, and they have sickness and they need coverage. They have no other, choice.
At the Coordinated Care Call Center, residents can be directed to the plan that is right for them, from options that offer free care to the Vita Health program, which is available to nearly everyone.
That's the only drawback. If you're eligible for Medicaid, Medicare, veterans benefits, Florida Healthy Kids, then you will not qualify for our program.
Robert says what he pays each month is minimal compared to what he has gotten back.
I didn't even know that I had life-threatening situations going on with me. And they helped me with that immediately. And I'm basically very, very grateful.
The numbers applying for county programs have increased 25% in the past 6 months. And Ronnie doesn't see that going down anytime soon.
Well, the numbers are alarming. For instance, if you look at the Glades, they have increased almost 50%. The economic downturn is really affecting in the western suburbs, but you see it in Glades, and you see it in Boca, in Delray, West Palm. It's all over across the board. It's affecting everyone. Now it's affecting the middle class, which we hadn't seen before.
But many wait until it is nearly too late for help.
A lot of people, for instance, come to us that are really sick. They wait until the last minute. They're not the most prepared, and that's why we've got to move quickly. Sometimes it's a matter of life and death.
I'm not alone at all. When you read the newspaper and you see how many companies are letting go personnel or watering down existing medical coverage, you realize that there's this gigantic healthcare problem that's looming, and it's coming to a house near you, if not your own home.
Now, those running Vita Health say they expect the numbers of those applying to continue to increase. And come October, the program will expand its guidelines to allow more families to become eligible.